guys, welcome back to my channel. If you're new here, I am a registered nurse here in the Philippines. Although I'm very new to the profession, but I'll be doing my best to help you guys with all your questions and tips that you'd like to know about surviving nursing school, since it's still very fresh to me. So yeah, today we're gonna talk about how I do pathophysiologies, how I make it more easier to remember the things like the diseases and the effects on different body parts. So yeah, without further ado, let's start. So if you're still in high school, I definitely recommend that you take biology and chemistry seriously. I don't know if it's new already in the curriculum right now because it's K-12, but before we had biology wherein we tackled the different body systems, and in chemistry where we actually had advanced chem. So yeah, chem was like okay for me when I was in uni, but biology is like hella important because it's gonna be part all throughout the 4 years that you're gonna stay in nursing school. Because if you don't know the anatomy and physiology, then you'll be able to find it hard to understand the pathology of a certain disease. So that's my first tip. Take chemistry and biology seriously if you're still in high school. It's not too late. Take it seriously. I swear it's gonna help in uni. So I actually found it kind of manageable, chemistry and anatomy, because it was just like a review to me. The basic concepts were already embedded in my head. I already know how the heart works, like the pulmonic and the systemic circulation, without even like trying hard to remember it, because when we were in elementary it was already taught to us, and then in high school it was taught again, and then in college, it's paulit-ulit. So alright, so my second tip will be, if you're already in the nursing program and you're struggling in those subjects because you were not very prepared when you graduated from high school, I guess, or it's just sometimes too overwhelming that stress kicks in and everything else. But one thing that I can suggest that you do is to make a flowchart, if possible, of everything. So for example, the circulatory system. So let's start with the pulmonic route. So as we all know, blood coming from the different parts of our system goes back to the heart deoxygenated, meaning it doesn't have oxygen anymore. So what we need to do is to make the heart oxygenated again, and then the heart will pump it again to the systemic circulation. So pulmonic meaning towards your lungs, and then systemic towards the whole body. So first, for the pulmonic system, wherein the deoxygenated blood gets oxygenated. So it first goes into the inferior and superior vena cava, and after that it enters the right atrium, and then the right atrium pumps it to the right ventricle through the tricuspid valve, and then it goes to the pulmonic artery, and then to the lungs, wherein it is oxygenated, and then after that it goes back to the heart through the pulmonic vein. The pulmonic vein is the only vein that carries oxygenated blood, you guys. These are basic things that appears in anatomy and physiology exams, which you should already know by heart. And also the pulmonic artery, by the way, is the only artery in our whole body that carries the oxygenated blood. Alright, so going back, so from the lungs it goes to the pulmonic artery, wherein there is a pulmonic valve over there, and then it goes to the left atrium, and then to the bicuspid valve or the mitral valve, and then to the left ventricle, and then from the left ventricle it goes to the aorta, passing by the aortic valve, and then it goes to the systemic circulation. So paulit-ulit yon. Just draw lines like from a specific part to another part and then to another part, because in my opinion it makes it easier for you to like look at them because you summarize it in a way that is most effective for you, and you don't need to read a lot of paragraphs in the book anymore because you have a drawing right there. Just look at it and I got this, no need to open the books anymore. So yeah, that's just a tip. But it may not be, applicable to all body systems. Like for example, the brain. So we have the frontal lobe, the temporal lobe, the occipital, and then the parietal. And then you get a question that says there is a problem in the motor aspect of a certain person. What part of the brain do you think is most affected? Then I'll answer frontal lobe. So yeah, people will be like, paano mo naalala yan? Oh my gosh, I don't know anything about that. So, I just know from my biology class because, in uni, they don't really teach you like in depth anymore because everything is so fast and they're expecting you to already know about it because you're just given a small amount of time for certain subjects while you're in college. So for example, anatomy and physiology for us were like just one sem, I think. Yeah, it was just like 6 months. So for the brain, when you're asked about, for example, the motor aspect of the brain, and then you get the choices of frontal, parietal, temporal, and occipital, it's the frontal. I'll tell you guys why. In the frontal, we have the primary motor cortex. And then in the parietal, we have somatic sensory cortex. And then in the occipital, we all know it's for the eyes. And then the temporal for audio. So yeah, that's basically it. And if they're gonna ask me like some more in-depth, like very specific ones, I may find it hard, to answer that. But just, pick the best thing that you can see based on your prior knowledge. So yeah, that's how I, get around things in nursing questions and things like that. I just remember the most basic things because what is taught in anatomy and physiology is the normal functioning of the whole system. And once you go to the medical, surgical, and pediatric and other subjects, they're going to talk about certain problems in different systems that can be found in people. So yeah, it is important that you know the normal course and it'd be easier to identify which part of the normal system was disrupted. Alright, so actually someone asked me on Instagram to give tips in how to easily memorize and remember things in pediatrics. So I'm gonna give it as an example right now, a case in pediatrics. So since I already explained like a little bit about the heart, then I'll give an example related to the cardiovascular system. So for pathologic diseases, we usually study it depending on the systems involved. For example, we have ventriculoseptal defect. You know how the heart is divided into right and left part? There's a septum in between them. For VSD or ventriculoseptal defect, there is a defect in the ventricular part. So the atriums are over here and then the ventricles are down here. So there's a defect in the septum. So there's a hole in there. You might imagine what happens. So let's go back to the pulmonic and systemic circulation. So it always goes back to anatomy and physiology, guys. The pulmonic system involves the right atrium and the right ventricle and then to the lungs. As we all know, the blood going into the right part of the heart is deoxygenated. And then from the lungs, wherein the blood is already oxygenated, it goes to the left atrium and then the left ventricle. So if there's a hole, it's going to be mixing of blood, both deoxygenated and oxygenated over there. And we all know that the left ventricle pumps more blood because it pumps blood toward the systemic circulation and not just to the lungs. So meaning it's gonna pump more blood compared to the right atrium. And the right atrium is gonna pump harder. So it's gonna hypertrophy. So meaning mas kakapal siya because it's overworked. Since the left ventricle is pumping more than the right ventricle, since the resistance coming from the different parts of the body is higher compared to that of the lungs, the blood is gonna go to the lungs, through the pulmonary artery. So there will be increased pressure over there. But fortunately, VSD closes spontaneously, or they might get open heart surgery depending on the case. So the treatment, there are a lot of treatments. You must know the nursing ones. the medical ones, and the laboratories and things like that, and signs and symptoms, related to that. As long as you know how the disease works and affects the body, then it'll be easier to understand, later on. And also, when we were in uni, we get a lot of comments from our professors wherein every time we were asked about a management of a certain disease, we always answer surgery and things like that. But always remember that we have nursing interventions. It may be dependent, independent, or collaborative with the patient. For example, for fever, people do have fever sometimes. The first thing that comes into mind, you give paracetamol and it'll go away. But no, it's not the first thing that you're gonna do as a nurse. You're gonna assess the temperature, and then you can do TSB. You can adjust the temperature settings, Nightingale way. You need to do something before you report to a doctor and then go through with the pharmacologic one, So know your anatomy and physiology, know what the function of the system is, know how the system affects other organs, and try to write it in flowcharts. So the next one is that, based on experience, the more I get to see and read and hear a certain subject or a certain disease or a certain, topic, the more likely that I'll remember it. If you do have time, reread your notes, and then if you really don't have a choice but just read everything and not make flowcharts just yet, it's fine, because it's survival mode out there. But later on, please do go back to those notes wherein you are more calm, less stressed, because you're gonna understand some concepts that you might have overlooked when you're cramming. Rest after, for example, an exhausting exam, but do go back to the topics that you weren't really able to grasp or comprehend that much, because some things just make sense later on in life. You have a clear head, a better mental status. It's gonna be easier to comprehend. You're gonna be more patient in understanding the concept. And again, based on experience, when I kind of repeatedly encounter certain topics or subjects, it just becomes basic to me that really it just pops out of my head. It's just easy like that. And I just can't really explain to other people sometimes, because they ask me how do I remember everything, because I really don't know. Sometimes it just pops out of my head and then I got the correct answer. But it doesn't happen all the time, we do make mistakes, and that's okay. As long as you go back to your notes, learn it again, because it's gonna help you all throughout your career, not only in nursing school. So yeah, thank you guys for watching. I'm so sorry for the sound my air condition was making all throughout the video I did. So yeah, if you have questions, I'd be happy to answer them. Just comment down below, and see you guys on the next vlog. Bye!